Hello, good afternoon. I'm Catherine. I work in Nottingham at the Queen's Medical Centre as a hospital play specialist, and I qualified in 1985, and I have worked in the hospital since 1987. Sorry, yeah. I'm going to talk today about a family, with the family's permission, about a young girl that I looked after called Ellie, who was diagnosed with a granulosa germ cell tumour this year. She's a 7-year-old girl, and during the diagnostic period Ellie had some complications and she had to have quite a long stay on intensive care, and this resulted in her being extremely anxious. As part of her treatment, it was decided that she was to have a PEG insertion. However, Ellie wasn't quite so keen on that idea. In fact, she was adamant she was not going to have a PEG. So I had a referral from the Macmillan nurse and asked to go and meet Ellie at home and the family, which I did. I went to the house and met mum and grandparents, and we decided that it would be a good idea to go and see Ellie at school and discuss things further with her, which is what I did with the Macmillan nurse. So we went to her school and we had a chat about her feelings about having a PEG, and I showed Ellie a PEG, which was this, and explained to her how it was going to work and how it was going to benefit her. Then we decided that she was going to make a book for herself about having a PEG, and she was going to do this by using colourful pens and write and draw. I made a workable doll for Ellie here, which you can have a look at later, which has a PEG. Ellie loved the doll, it worked beautifully. She named it Lily straight away and began to explain to Lily why she needed a PEG and how she could have her feeds through it. So this is the first page of Ellie's book, which she entitled Why Having a PEG Will Help Me. And interestingly, her first point was that it would help her get better. So she understood that it was going to help her, and she understood it was going to help her put weight on, and that if she had a sore mouth, then that would mean that she could have medicine through the PEG and she wouldn't have to use her mouth. And she also understood that it was going to stop people nagging her, which she thought was great. She was very pleased that you could hide it in a bag underneath her clothes so nobody would see it. So visually it was similar to her Wigglies. And it also meant that she didn't have to have an NG tube, which again she was really pleased about. And one of the main benefits basically was that people wouldn't nag her. Really, that came out again. She wants to draw a picture of what it would be like for her with having a PEG, and she was very insistent and pointed out that she had a big smile on her face now because it was going to make things easier for her. And she also wanted to draw a picture of the PEG, so she very carefully drew this. It was at the side of her, and she's called this the medicine lines. This is the clamp, this is the line, and this is the squidgy pillow that's quite comfortable when you feel it. Ellie had also said to me that she would like to use her book to help children be less scared, to be able to see what it was like. So here's Ellie. Alison, no, Ellie. I got so confused, I rang up to see what time she was going to theatre, and I called her Lily and no one knew who she was talking about because that was the doll. So I went into school with Alison, who is the Macmillan nurse, and Alison helped let Ellie give her Wigglies a drink, which she thought was great. And she also let her help flush the fluid through. And after we'd done that, this was where I introduced Lily. I probably will get the names wrong. So this is Lily, and this was made for Ellie to keep. And she has a Wiggly and she has a PEG. so it was quite similar. She has the little bags made for both. So there she is. We had to adapt the doll so that it would actually work, because I find, having done this sort of thing with children in the past, if they can actually physically do the action, then it helps them better. So Lily had to have major surgery, which actually meant removal of her head. So didn't do that in front of Ellie or in front of any child. But basically what I found is the cheaper the doll, the better it is, because the more expensive dolls have batteries and are very hardwired and you can't get the head off. So this is just a cheap doll. You take the head off, and then there is a pipe that usually goes through attached to their mouth so that they can wee out the fluid. And so we took the head off, cut the pipe, and attached some oxygen tubing to that pipe, and shoved it back up in the head and put the head back on. And then with a screwdriver very carefully inserted a hole into the doll's stomach and pulled the oxygen tubing out. And I wanted to make it look something like, because of having to twist when they have the peg fitted, so we then sliced it with a stitch cutter and made that bit and got the peg bung at the end. So now when you can't feed her orally, but you can feed her here and she will wee. And so there's water if you'd like to try. She thought it was great that it actually worked and just looked after her beautifully. So then we drew a picture of Lily, and she has wigglies and a peg that you can't see either, which she was quite pleased to tell about, because she'd put clothes on her and you can't see them when the clothes are on. This is Theatre Day, and because of her past experiences, she was very anxious about theatre, as were Granddad and Mum. So I met them down at the lift, and we came up together. As you can see, Lily is poking her head round just there. So we went up to the ward all together. I made sure that Lily and Ellie had matching theatre gowns, so that they could go to theatre together, and spoke to the anaesthetist, who was great, so knew that Lily was coming down for the same operation. And because of Ellie's past experiences, she was really quite nervous about having the anaesthetic via a cannula or by her wigglies, and so she wanted to have a mask. So we played in the playroom using the mask for them both to go to sleep, and it worked really, really well. And here we are in theatre, and so far so good. And there's Lily. However, that's as far as it went well, because in the anaesthetic room, Ellie changed her mind just as we were getting the mask towards her face, and got upset. She cried, which I haven't got a problem with crying, because that's a way of her expressing how she's feeling. But she said she wouldn't have a mask anymore. But when asked if we could use her central line, she carried on crying and said yes, and was put to sleep with her central line. And when she woke up, I said to her that I thought Lily went to sleep first, but she did really well, and she said absolutely not, I went to sleep first. And she was fine. And on coming out of the anaesthetic room with Mum, Mum said that was by far the best experience she'd ever had in the anaesthetic room, and because she cried far less, and her body was very relaxed. So it was more a communication as opposed to complete distress. And there she is awake. The first words when she woke up were, "I'm hungry and I want food now." And then she wanted to see her peg, and was adamant she wanted me to take a photograph of her and Lily smiling, because now things were going to get better. And then we took a picture of Lily's peg, and we took a picture of Ellie's peg. It's not been plain sailing at all with Ellie, but she really has benefited a lot from the work that we did before. And we have used Lily together on the ward to explain to another young boy that was going to have a peg inserted, and she very proudly went through the whole book, which is here. She proudly went through the whole book, explaining to him what would happen step by step, how much better it was going to be, was a complete advocate for having a peg. And she allowed him to see her doll, and she allowed him to use her doll as long as he changed the nappy afterwards. But she's very, very proud of herself, and as you can see, that's it.